tie. Botox is one of those things that many people who strive to lead a very natural lifestyle shy away from. After all, isn't it unnatural to want to freeze parts of your face? Well, the truth is, aging is the most unnatural thing of all. In a brilliant paper titled Death as an Unnatural Process, bioethicist Arthur Caplan argues that the changes in our bodies during the aging process parallel those changes that occur during paradigmatic examples of disease. He says, and I quote, "And this makes aging unnatural and in no way an intrinsic part of human nature." What is natural, on the other hand, is the drive within us to preserve ourselves. And for me, Botox is part of that preservation process. So come on, let's go and see the best injector on the Gold Coast, cosmetic physician Dr Mark Jeffery. At Ooh La La with the owner and medical director, cosmetic physician Dr Mark Jeffery. And I'm really grateful that Dr Jeffery has agreed to talk to us today about anti-wrinkle injections. Firstly, Doctor, what would you say are the advantages of using anti-wrinkle injections?
Okay, well, let's just go back to how it was discovered. It was actually discovered by an ophthalmologist that experimented using botulinum toxin in children for skin surgery.
Oh, wow.
And from then, a couple of, over time, Canadian doctors started using it for cosmetic purposes and did all the clinical trials with the product. So its main uses in cosmetic medicine is it's actually just it's a muscle relaxant. So it prevents lines and wrinkles forming over time from repetitive muscle movement, and it's particularly good in the upper third of the face where we use it, so around the eyes, the frown and the forehead, but it can be used in the lower part of the face as well. Botulinum toxin has a wide usage. The dosage of in migraines and it's also quite effective, and in neurological conditions is quite significant. And the doses that we use in cosmetic medicine are very low compared to those other areas. So it's a very, very safe drug to use, and there's no toxicity from the drug. We don't usually use it obviously in pregnancy, but those are the main indications that we use it for. It's got a big place in cosmetic medicine.
Yeah, oh wow, thank you.
So in terms of advantages in cosmetic medicine, the main is people feel refreshed after these injections.
Yeah.
They get brow elevation, they get reduction of lines. It's actually been shown to be effective as an adjunct in depression as well for that reason.
Wow.
So yeah.
That's really interesting, thank you. Can anti-wrinkle injections cause muscle weakness over time?
My answer to that's probably a mixed answer. It depends how you define it. I mean, if we look at patients that have blepharospasm, who have multiple injections over 30 years, they don't end up that they can't open their eyes. What we do tend to see in cosmetic medicine, when probably inappropriate doses are used over a long period of time, that we get some skeletonization happening. So we see that on the forehead, where you get some muscle atrophy. The muscles will always come back, but I wouldn't say per se that there is muscle weakness. It's just more that the muscles are in a period of inactivation, and there is some not disuse of the atrophy of the muscles, but in the right areas at the right doses. Once again, I've said the doses are quite low where we use, and if you assess your patients appropriately and you look at the movement carefully, no, the muscles will always recover. There's no permanent loss of muscle per se.
Sure. So, should we have intermittent breaks from anti-wrinkle injections, or is it safe for us to use continuously over the long term then, like for wrinkles and stuff?
In the short term, we try and encourage patients to do it regularly if they can afford to do that, for the simple reason that once patients have had it for a period of time, what we tend to find is that there's a dose reduction that eventually kicks in, and so patients have it less. And
I didn't realise that.
Yeah, I suppose the only other thing that we are concerned about is antibodies to botulinum toxin from repeated use. It is described in the literature, but I think globally, if we look at the evidence, it's still quite low relatively. So, that's one question you may ask: is there resistance? The only type of resistance you get is if there's antibodies to the toxin, but to the protein that's in the actual toxin.
Okay.
So if they want to have, if they've got a function and they just want something, that's fine. If there's others that prefer to have it regularly, well, that's their choice. We don't force it upon patients to do it. It's got to fit within their discretionary budgets.
Yeah.
So yeah, you can safely have it for a long time. Yeah.
So today I'm here to get anti-wrinkle injections for my forehead, eyes and nose. Can you tell us what muscle you'll be injecting under my eyes to try and flatten that bulge when I smile?
That eye muscle
is
called the orbicularis oculi muscle.
Oh wow.
Okay,
so you're injecting that?
So you can see it's a wide muscle, goes all the way around, and we have to place several injections depending on the lines that we're trying to treat. Okay, that's really interesting. So that's my approach anyway. I don't just have a standard dose for everybody. I tailor it to their needs.
Oh, wow.
When we come to the frown, we have what we call the brow depressors. That muscle is the procerus muscle and is bridged on either side by a muscle called the corrugator supercilii. And we inject this frown complex of muscles.
Oh, wow.
Okay, and that is what makes everybody happy.
Oh, yeah.
Less the brows.
Yeah.
That means you can't get angry at anyone.
I can't frown at hubby.
There are potential things that can happen. Sometimes if you inject the brow, it can get too heavy, or if it's an older person and they've got very hooded eyes, you can cause a brow ptosis, and they don't like that at all. But that's about it. Sometimes an eyebrow can spock. Go up, but it's very easily corrected.
Okay.
And don't forget, we're putting injections in, and they diffuse and spread at different distances depending on what botulinum toxin you're using.
Okay. Oh, thank you so much.
Okay, so we're just going to do the lateral canthus eye muscle, which is commonly called the crow's lines. I can see quite obviously where Suvi's movements are. She's still got a bit of residual botulinum on board. I've injected her before, so we're just going to go ahead. A very tiny needle, it's an insulin needle.
So it doesn't hurt too much?
There's no pain with it, just relax. Sometimes you can hit a little blood vessel. Obviously we don't like that to happen, but
I'm a bleeder too.
It's not common. Smiling for me. Okay, once again I can see where the main movement is. Okay, relax. Actually, I was just referring earlier to patients with facial nerve palsy, and I've got a particular patient. They get synkinesis.
Wow.
which is when one muscle contracts, there's an involuntary contraction of another muscle.
Oh wow.
So
they can't even control it, and
yeah,
then you can
so
sort of help fix.
So you try and inject the muscles, yeah.
Oh, that's really cool.
Generally, I tell patients 3 to 5 days, I'll notice that it's working.
Okay.
And
Yep.
usually cements itself within 12 days to 14 days.
Okay. And is there any precautions I have to take? Like, should I not rub for?
Yeah, don't rub where you put the product in the first 24 hours. There's some other instructions that they recommend, in terms of lying on your face immediately or going and running a marathon straight after.
No chance of that.
Okay, yeah, we're done.
So it's a week later now, and I'm really happy with the results of the anti-wrinkle injections that Dr Jeffery gave me last Saturday. Even though I got very little sleep last night because we just got a new puppy, I do feel refreshed. I got a nice brow elevation and a reduction in lines, which I'm really grateful for. Because as much as I love the lines on this adorable little guy's face, I'm not so keen to have them on mine.